Hey guys, welcome back to Radiology Lens. The topic for today's video is the concerning findings of pregnancy failure on ultrasound. These findings are not diagnostic for pregnancy failure. However, they have a high chance of going into failure. A repeat sonogram is often recommended after 2 weeks to confirm if the pregnancy has progressed or gone into failure. So let us see what are these ultrasound findings. So the first one is crown rump length or CRL of less than 7 millimeter with no cardiac activity. Number 2, mean sac diameter or MST of 16 to 24 millimeter with no visible embryo. Number 3, empty amnion, an amnion seen without an embryo inside. Number 4, enlarged yolk sac of greater than 7 millimeter in diameter or a calcified yolk sac. Number 5, a small gestational sac relative to the embryo size. Number 6, irregularly shaped gestational sac. Number 7, a heartbeat of less than 90 beats per minute after 6 weeks. Number 8, low position of the gestational sac in the uterus. Number 9, the double Blef sign. The double Blef sign is actually a normal finding. It consists of a yolk sac and an amnion. Normally, an embryo would develop between the yolk sac and amnion within a week. But if there is a persistence of the double Bleb sign beyond a week, that can be concerning for a failed pregnancy. Now let's see a few ultrasound images of concerning findings of failed pregnancy. In this ultrasound image, you can see an embryo with a crown rump length of 0.42 centimeters, but this embryo does not have a heartbeat. In a normal pregnancy, when an embryo is visible, it must always have a heartbeat. In this ultrasound image, you can see the empty amnion sign. The amnion does not have an embryo inside. In a normal pregnancy, an amnion must always have an embryo inside it. This image shows a yolk sac greater than 7 millimeters, and this is an abnormal finding. In this image, you can see a gestational sac with a mean sac diameter of 16 millimeters without an embryo. The mean sac diameter between 16 to 24 millimeters must have an embryo for a viable pregnancy. Now this image shows a small gestational sac relative to the embryo. It is also known as the first trimester oligohydramnios. It has poor outcomes. This image shows a gestational sac in the lower portion of the uterus. This pregnancy also has a very little chance of progressing. Also note in this image the IUCD seen in the cervix. Now this image shows the double Blef sign with the yolk sac indicated by the thick arrow and the amnion indicated by the thin arrow without the embryo. In this image, you can see a gestational sac with irregular borders. In a normal pregnancy, the gestational sac has a smooth contour. This brings me to the end of the video. If you enjoyed watching it and found it informative, please like this video and subscribe to my channel, and inshallah I'll come up with more such content. Thank you.